We first told you about 3 weeks ago, 30 nurses or so have been given their layoff notices from St. Joseph's Hospital in the Comox Valley. They are being replaced by the less trained and less paid licensed practical nurses, LPNs. Ever since the announcement of that, there has been a growing backlash from the nurses and from the community. The hospital says the cuts are necessary, but the public is not buying it. A-News reporter Gord Kurbis has the story.
The sandwich boards are fresh from the printers and they will be pressed into action beginning tomorrow. Members of the Health Employees Union from St. Joseph's Hospital will be taking their message to the streets.
We are the frontline workers. We're the ones that provide the care. We do not believe that this model that St. Joseph's is presenting will be good for the patients that we look after.
Barb Biley says the 520 members of the Health Employees Union she represents is united with medical staff from the hospital who are also opposed to the proposed changes.
What the hospital is talking about is changing the second floor of the hospital from acute care to a transitional care unit. And we believe that this is really, really bad for health care.
The change would mean those patients would be looked after by care aides instead of licensed practical nurses. After the announcement, hospital president Michael Pontus said the move is necessary because of the changing needs of the population.
It's not a reflection from us of nurses' abilities or skills. It's doing the right thing for the patients.
The restructuring is expected to save somewhere in the neighborhood of $1 million. Pontus acknowledged the objection of the hospital staff.
And we know that it is upsetting to them. I'm sure they understand it's the right care for the patients, but it is upsetting because it certainly is a displacement of nurses.
Hospital employees have started a petition they'll be circulating throughout the community. It's directed to the administration at St. Joseph's as well as 4 MLAs representing areas where patients feed into the hospital.
Any change in the health system is obviously going to become with some people being nervous about it.
Comox Valley MLA Don McCrae is one of those 4, and today he met with a delegation of hospital staff as well as the hospital's president.
I'm encouraging the stakeholders to come forward, whether it's a nurses group, whether it's a physiotherapist, but it's really important that we make sure that if there are concerns that haven't been addressed, that they do get addressed both by the Ministry of Health and by VHA, and I want to make sure that level of information is given to everybody involved.
Hospital employees are in the process of putting together a town hall meeting to take their views directly to the public. That meeting will be held April 24th from 2 until 4 at Mark Isfeld Secondary School. In Comox, Gord Kurbis, A-News.